Hello, I'm Dr. Evan.
And I'm Dr. Zach.
And we're with Advantage Chiropractic, and this care package was made for you. It was given to you by a family member, a friend, a loved one, and today we're going to talk about neck pain. The main three things that we want to talk about when it comes to neck pain is, well, where does it come from? What you can do at home to start really combating that, and then last but certainly not least, give you some action steps on how you correct that neck pain so you can get back to the life that you live, because neck pain is really created by three main things within our body. There is a structural component, there's a muscular component, and then last but certainly not least, there's going to be a neurological component.
Exactly. So let's go over those three that Dr. Evan just talked about here. So let's start with the structural component like he was just saying. So if we look at the spine here and we look at the neck, we have a nice C curve just like this. So what can happen if it's those microtraumas, sitting in a fun posture like this, if it is those car accidents, slips and falls, sports injuries, whatever it is, that neck can straighten out and it can start going the opposite way as well, kind of like that. So we can see when your neck's looking the exact opposite way, that can lead to a lot of problems in that neck pain that you've been dealing with. The second one is the muscular aspect of it. We all heard that my neck is really tight, I can't look left, I can't look right. Couple things: if our neck doesn't have that perfect curve, those muscles are going to get tight. If you're working out a lot, if you went and started doing some strenuous activity, running, whatever it is, can really start putting some tension in those muscles, leading to that neck pain. And third, and most importantly, we have to look at the neurological piece. The big thing is, especially in the lower part of your neck, those are the exact same nerves that control all the big muscles of your neck. So when that neurology isn't functioning properly in that lower part, we're going to lead to a lot of that neck pain that you've been dealing with as well.
Absolutely. So one thing that we want you guys to look out for, especially at work, or if you're working from home at this point in time and you're sitting a majority of your day, there's going to be two components to it: the computer height as well as your posture while seated. So number one, if we start slouching, so bring that up and through, and we're sitting there and working all day, all of us can see what this can ultimately lead to when it comes to not only the tension, the pain, but the problems that it can lead to on a structural, muscular, as well as a neurological component. So the important key here is making sure that your computer is actually at the correct height so that it can bring that head back up and over, because what we want to see is we want to see ear in line with the shoulder, and then the shoulder coming all the way down and align with those hips. As we're starting to look at the computer, the one thing that you want is you want the middle of the computer to be directly at eyesight. If you are a person that has 2 or 3 or 4 monitors, ideally you have 3 monitors, because what you're going to do is you're going to put your main monitor in the middle, one on the left and one on the right, so that you're not always only turning left or always only turning right. We want to make sure that it's equal throughout the day.
So starting with some of those exercises I'm going to demonstrate here on Dr. Evan. The first one, we're going to do very simple range of motion exercises. So the first one I want you doing at home is looking down at the ground as far as you can, and then all the way up to the ceiling. Good. And what we're going to do, we're going to go 10 times each way for a total of 20. The next one I'm going to have you do is I want you looking over your left and your right shoulder each way. So again, 10 to the left and 10 to the right, just like that. And the third and final one, we're going to do some lateral flexion. So I want him to bring his right ear down to his right shoulder. Beautiful. Up, and then all the way over. Again, 10 each way for a 20 total. The big thing is, guys, when we're doing any of these stretches or exercises, or giving you any advice, we don't want this to be painful. Yes, it might be a little sore. We understand that. If you're getting any sharp shooting pain, any pain that's lasting for more a day, please stop, give us a call. We can always modify these and change these. Again, everyone's going to be different. This is going to be very individualized healthcare for you and what you are dealing with. The next exercise I want to show you here is called Brugger's position. So what Dr. Evan is going to do here is going to turn his hands out just like this. He's going to bring his shoulders up and back and roll them down. And the big thing too, he's bringing his head back, so he's staying in a nice structural and postural position. The big thing here is we're going to open up the chest area, and when we do that, that allows your neck to come back up and not being rolled forward. All right, guys, those are just some simple stretches and exercises and things you can be doing at home to really combat the problems that you've been having. So the big thing is we got to see if it's neurological, if it's muscular, or if it's a bone issue, or a combination of those three.
Absolutely. So seeing as you have this video, it was sent to you by a loved one, by a friend, we want to let you know that you have an opportunity for a completely complimentary consult and exam with us. And the goal with that is to really figure out if it is neurological, if it is structural, or if it is muscular, or those combinations that we were talking about, to really give you those answers on what you can do to really correct what's going on so you can live the life that you want to live. So if you have any questions, if you're interested in setting one of those up, call us at the office, 262-505-5610. You'll speak with Melissa or Sierra. Make sure you mention that you have one of these videos, and we'll ultimately get things moving in the right direction. Thank you so much, and as always, live the advantage.